Almost a month has gone since the fateful 19th February night when one of the world's most terrifying medical error happened inside a Kenyatta National Hospital theatre. Finally, after conducting an inquiry, the Kenya Medical Practitioners and Dentists Board has reached a verdict.
The committee holds that a surgical procedure was done on a wrong patient as a result of systemic lapses at Kenyatta National Hospital, thus affecting the functioning of different professional cadres who were working at the hospital at the material time.
The board has noted that a nursing error led to the mix-up.
Nurse Gideon Mwangi confirmed that he reported for the night shift on the evening of 19th February 2018 when Nurse Rita Akinyi did a verbal handover of 61 patients of his other colleagues who had not reported to work, and he recorded the same in the nurse report book. He stated that he saw the patients who were in the ward through a window, and he could not clearly point them out as the wards were crowded.
Ward nurse Mary Wahome particularly finds herself at the eye of the storm.
The said nurse admitted being aware that the patient was in a confused state, but not being requested to deliver one John Bugwa Deritu to the trauma theatre. She went to room 2 with a porter and shouted his name, and she then prepared and labeled the responsive patient before taking him to theatre.
I was very shocked.
The committee finds that the appropriate regulator should consider whether the said nurse is fit to practice under such an environment.
This report is, they say Mary Wahome had been ill or she was not well. It is important that we see the documentation.
The surgical team noted the error upon opening Samuel Wachira's skull, as there was no clot in his brain as displayed on John Deritu's CT scan.
The findings that the competence of the Dr. Anson Nganga Kamau, who undertook the surgery of the patient, assisted by Dr. Mose Mora, could not be questioned, as his team reviewed the document presented to them in theatre appropriately and thereafter undertook the proper procedure that would have been expected in a proper scenario.
As the doctors' board delivered its verdict, CS Sicily Kariuki and her team, comprising KNH Board of Management, came under fire as she faced members of the National Assembly's Health Committee over the blunder and how it was managed.
If you try to cover or defend, you make the whole thing terrible.
Clearly, there are things that need to be fixed without getting personal about issues. But really, like I said to the board when I met, I have come in because you have failed to take action on a very, very sensitive matter that is before the public, and the jury is not now in the public.
The nurses and anesthetists involved in the botched surgery will know their fate once their respective regulatory bodies investigate the role they played in the mistaken surgery. Sylvia Chebet, Citizen Weekend.